Medication management is a presentation of the South Florida Geriatric Workforce Enhancement Program at Nova Southeastern University. This presentation is designed to promote and develop an age-friendly health system at NSU and throughout the United States. Medication management is the second leg of the 4 M's of age-friendly healthcare. Integral to best practice in caring for the population of those 65 years and older is the management of medications. This includes application of the Beers criteria in choosing the best pharmaceuticals for those 65 years of age and above, and avoiding those medications that evidence-based trials have shown are unsafe or even potentially dangerous to our patients. What may surprise you is that good prescribing also includes de-prescribing. Medication should first and foremost improve the health and well-being of our patients. I have no relevant affiliations or disclosures. The purpose of the Geriatric Workforce Enhancement Program is to improve health outcomes for older adults by integrating geriatrics with primary care. This may be achieved by developing a healthcare workforce that maximizes patient and family engagement. Today, I will explain the 4 M's framework and how careful prescribing of medication applies to the establishment of an age-friendly health system. The 4 M's represent core health issues important to older adults based on strong evidence. They have the essential fundamental elements that systems need to provide older adults with the best care possible. What matters involves an understanding of what each patient's health goals and care preferences are. This is necessary to know and align care for them. These include self-determination, enjoyment of life, including end-of-life decisions. Medication. If medications are necessary, using age-friendly medications that do not interfere with what matters, mentation, or mobility, is vital to allow them to live their best life. Mentation. Mentation includes preventing, identifying, treating, and managing depression, dementia, and delirium across care settings. Mobility. Ensuring that older adults move safely every day to maintain function and do what matters to them. Mobility optimizes virtually everything. Using the 4 M's as a guide, evaluate with the patient and family if available, whether they are living their best life. Ask them, what does a good day look like to you? Then evaluate with your patient if medications taken are helping or hindering their goal of doing what matters. Are they able to engage in hobbies, socialize, and complete self-care tasks? Are medications affecting mental status in a way that enhances or hinders their ability to have a good day? Are medications taken aiding to achieve their mobility goals? Recall that the 4 M's are not an overlay or addition to usual geriatric care. Rather, they are synergistic and reinforce one another. The 4 M's offer a new way of organizing care for older adults by ensuring that essentials are covered consistently in every setting that care is delivered. Consistency leading to continuity of care with best outcomes. Scope of confounding factors. While 12% of the population of the US are 65 years old and older, 34% of all prescription medications are used among individuals in this age group. 30% of all over-the-counter drugs and herbal supplements are used by those over 65 years of age. The potential for adverse drug reactions increases as numbers of medications used and medical conditions increase. Renal and hepatic function declines decrease drug clearance and may prolong drug half-lives. Decreased hepatic metabolism may result in variability of medication availability. Consider body composition. Elderly tend to gain fat and lose muscle mass with advancing age, both of which change the way that drugs are distributed to and broken down in body tissues. All these factors increase the risk of adverse drug reactions. Serious adverse drug reactions may be confusion, delirium, depression, malnutrition, and falls. About 60% of elderly take prescriptions improperly, resulting in approximately 140,000 deaths per year. The additive confounding factor is the fact that pre-marketing trials often exclude geriatric patients. This is vital to recall, considering that age-related alterations in absorption, distribution, metabolism, and excretion interact with physiologic effects of medications, in sometimes unpredictable and unfavorable fashion. Prescribing with an age-friendly focus is an opportunity to partner with your patients to help them avoid adverse effects from the very medications prescribed to improve their quality of life. The Beers criteria is a list of potentially hazardous medications for patients over 65 years of age with guidelines for healthcare professionals to help improve the safety profile of the medications prescribed to older adults. Drug warnings are based on 5 criteria. Drugs potentially inappropriate for most older adults, drugs that should typically be avoided in older adults with certain medical conditions, drugs to use with caution, drug-to-drug interactions, and drugs that should be avoided to have their dosage reduced based on the individual's kidney function. The 4 M's require consideration of what medications have the highest safety profile for elderly, and conversely, which medications should be avoided. The first consideration concerns necessity. Is this medication necessary? Are there alternative modalities? Recommend lifestyle changes before prescribing, as we do with newly discovered elevated A1C. Lifestyle before medications, whether it is hypertension, obesity, diabetes, or GERDs. Recommend and encourage lifestyle modifications before prescribing medications. If they are experiencing vertigo after an upper respiratory infection or in the presence of allergies, consider treatment for postnasal drip and Epley's maneuver before ordering meclizine. For sleep disorders, recommend lifestyle counseling, such as diet, exercise, magnesium, melatonin, light therapy, and then reevaluate at a later visit. The second consideration is safety. Is this medication safe in this age range? What are the potentially harmful side effects? Anticholinergic medications are associated with sedation, confusion, and urinary retention. Sedatives are associated with confusion and falls. Tricyclic medications and antimuscarinics all have concerning side effects. Third, consider risk versus benefit value. Are the side effects worth the usage of these medications? Some potentially inappropriate medications. The American Geriatric Society has compiled an updated Beers criteria listing potentially inappropriate medications. These medications present an unfavorable balance of benefits and harms for older people. Considering that medications play an important role in the health and well-being for many older adults, it is incumbent upon providers to avoid, whenever possible, those medications that have evidence of poor outcomes from their use. Here I've listed some common medications considered potentially inappropriate. Anticholinergic medications, such as first-generation antihistamines, antimuscarinics agents, such as oxybutyrin, antispasmodics, dicyclamine, scopolamine, belladonna, antiparkinsonian drugs, such as benztropine, Artane. Side effects include drowsiness, dizziness, constipation, and dry mouth. These are all anticholinergic medications with unpleasant side effects. All drugs with anticholinergic properties block acetylcholine receptors. Chronic interference with acetylcholine receptors is harmful to all individuals, especially to speak to the population of our focus, the older adult. Acetylcholine plays a role in motivation, arousal, attention, learning, and memory. It is also involved in promoting REM sleep. Studies have shown that elderly individuals taking anticholinergic drugs were at an increased risk for cognitive decline and dementia. Discontinuing anticholinergic treatment is associated with a decreased risk of cognitive decline. Other medications to avoid include proton pump inhibitors such as Protonix, Prilosec, Prevacid, Nexium. These are associated with a high risk of poor nutrient absorption, osteoporosis, and Clostridium difficile. NSAIDs are associated with decreased renal function, increased blood pressure with increased risk of heart attack and stroke. They also prolong bleeding times. These are all medications that, for well-defined reasons, should be prescribed for limited duration or avoided altogether if possible. Antiarrhythmic agents such as amiodarone are toxic to thyroid and lungs. Alpha blockers, alpha antagonists such as doxazosine, clonidine. They have side effects of somnolence, depression, orthostasis, and dizziness. Benzotropines, benzodiazepam, and non-benzodiazepam hypnotics have side effects of sedation, confusion, and falls. Sulfonylureas and insulin have side effects of hypoglycemia. To quote Dr. Michael Steinman, a co-chair of the American Geriatric Society Beers Criteria Panel, the AGS Beers criteria should never solely dictate how medications are prescribed, nor should it justify restricting health coverage. This tool works best as a starting point for a discussion, one guided by personal needs and priorities as we age. It is vital to evaluate your patient's understanding of how to take medications and why they are taking medications prescribed. Recommend the creation of a folder to keep medication package inserts available for reference. They may want to involve family members in aiding understanding and monitoring of medication administration as needed. If they are experiencing side effects, recommend they write down the concerning side effect to discuss with their primary care provider at upcoming visits. As their provider, evaluate the medications and whether the medications is needed. Medications and mentation. Medications impact the entire body from the brain to the toes. Encourage your patient to bring their list of medications denoting which medications are helpful in meeting goals or which hinder goals of care to their next visit. Do they notice increased confusion, disorientation, or brain fog? Have them keep a record of adverse drug reactions or unpleasant side effects. Medication safety tips for patients. Fill all prescriptions at the same pharmacy so the pharmacist can check for interactions. Keep a list of medications handy at all times. Include prescribed dosage, reason for usage, prescribing provider, over-the-counter medications and supplements. Medication prescribing best practices. Review medications and supplement lists at each visit. Avoid adding medications to treat side effects for existing medications. Use affordable medications so patients aren't tempted to skip doses or take half doses to make it last the month. Maximize doses before adding additional medications. Avoid duplication of the same class of medications and reduce unwanted or harmful medications. Confirm that your patients are taking all medications prescribed before adding another medication. De-prescribing is part of good prescribing. De-prescribing is the planned and supervised process of dose reduction or stopping medications that are not helpful or that are actually harmful. While there is a time and place for medications, there is also a time to reevaluate medication usage. An example would be an 80-year-old without cardiovascular disease. They may not need continued statins. If the patient has lisinopril with a cough, consider changing the agent rather than ordering cough medication. Calcium channel blockers with peripheral edema and orthostasis. It's decision time. Should you prescribe a diuretic or change the agent? Unless there is a specific indication for a calcium channel blocker, consider an alternative antihypertensive. Avoid adding an agent to treat side effects from another agent whenever possible. Decisions begin with conversations. Conversations with patients, conversations with providers, specialists, and pharmacists. Patients will often ask about decreasing medication loads. Consider the request and jointly decide if it's possible given the risk and benefits of doing so. Resources are available at de-prescribing.org. If you have any questions, please feel free to email me at dk644@nova.edu. Thank you so much for your attention. For documentation purposes, please follow the survey link and fill out the survey that we might document your impressions and your visit. Thank you.